Здравствуйте, уважаемые коллеги. Сегодня разрешите начать сессию. Сегодня у нас сессия называется «Образовательная школа практического врача. Новое в диагностике и лечении сердечно-сосудистых заболеваний и внутренних болезней». И хотелось бы с удовольствием представить для приветственного слова и презентации профессора медицины медицинского колледжа леди Хардинг Рамеш Агарвал. Please, Ramesh Agarwal, are you here?
Yes, good morning.
Morning, nice to meet you, Professor. It's time for your talk. Sorry for delaying.
No issues. So I will start with the presentation. And at the outset, I am very grateful and thankful to the SCO and the organizers who have invited us for this important forum on the medical issues and the medical development related to cardiology. So I shall be presenting on the Indian aspect and will be sharing the slides. Good morning once again. So I shall be telling about the non-communicable diseases, about the Indian perspective and its preparedness. I hope my slides are moving. So the priorities for control of non-communicable diseases, NCDs, and cardiovascular diseases. So India has been always vigilant and always careful to understand that non-communicable diseases, they require both the prevention and the treatment simultaneously. So we adopted a program of prevention of non-communicable diseases, particularly the cardiovascular diseases, at a very, very early years. And we understood that the risk factors which are responsible for non-communicable diseases, they have to be addressed if we really want to control these diseases. Of course, the early diagnosis and adequate treatment is required for all the patients. A very unique feature which we understand is that the health services which are available should be accessible to all the citizens, barring rich or poor. And we assure that by participating in such events and by collaborating with the worldwide technology, we offer the best to our citizens and to our neighboring countries. And we also assure that training of doctors, nurses, paramedics, they go simultaneously along with the research and the upgradation of the guidelines, which is a continuous process. So with this small brief, let me tell you how the India has faced the burden of the non-communicable diseases. So if you can appreciate that somewhere in 1990, India was struggling between both the non-communicable diseases and communicable diseases. Communicable diseases like diarrhea, like malaria, vector-borne diseases. So they were in majority of the numbers, to the extent of 61% of the diseases were communicable. And we were not struggling with non-communicable diseases. However, as throughout the world, there has been an epidemiological transition, and we now see that the non-communicable diseases, they have taken an upper hand, and now we, as all the other countries, are facing with this transition, and non-communicable diseases, they are to the tune of 55%. And NCDs, they are estimated to account for 63% of all the deaths. So that's a huge number, and of which the cardiovascular diseases, they lead with 27% of the overall mortality. And chronic respiratory diseases, they are also not far behind. And we all know that they also introduce atherosclerosis in the body by inflammation. And they are responsible for 11% of the deaths, cancers for the 9%, diabetes for another 3%. So this is a huge number, which is causing a huge mortality in our country and worldwide. And if we just narrow down it to it, maybe somewhere about 700 to 1,000 deaths per hour. So it becomes utmost important not only to diagnose and treat, but to detect, screen, and prevent cardiovascular diseases. This is our journey. We started somewhere in 1975 when we saw that this epidemic is going to really pose a great challenge. And we responded to this challenge as early as 1975 when we launched our program of a national program for control of cancers, diabetes, cardiovascular diseases, and stroke. And we ensured that this program reaches the very basic unit of our own structure of our country in the districts, which began as a pilot project in, say, 10 districts, and it expanded within a span of 5 to 10 years to almost 468 districts. And this program also included some tobacco control programs, screening for cancers, national health policy. It was integrated with population-based screening somewhere in 2017. And we saw dramatic change when this was introduced with a comprehensive primary health care through health and wellness centers. So these health and wellness centers are present at a very basic, at a very village level, at a very primary level of our country. And this was integrated with another common upcoming non-communicable disease, which is non-alcoholic fatty liver disease, and programs related to COPD. And we made sure that we revised our guidelines for treating ST elevation MI, chronic kidney disease, stroke. And there was an initiative of 75 into 25, which I will be coming in the upcoming slides, which was related to treatment and screening of hypertensive and diabetic patients. So it's a long journey, but we made sure that we update ourselves and prevent these non-communicable diseases. So National Program for Prevention and Control of Non-Communicable Diseases. Now, as you see, it is now almost in all the states with the 716 districts, 744 clinics, a huge number of community health center, district daycare centers. There are cardiac care units, there are tertiary care cancer centers, and there are state cancer institutes which facilitate the prevention and treatment of cancers. So these are the basic highlights under which we work. It's a health promotion and awareness. a very unique program where our leadership emphasized that there should be a eat right movement and fit India movement. So if we eat right, if we keep ourselves fit, probably majority of the things will be done away. Then there's a national multi-sectoral action plan where all the government bodies work together for implementation of this program. Screening is important, especially the age has been almost cut down from 40 or 45 years a decade before to almost 30 plus years, where we all are now getting prone to NCDs. Management of common diseases like hypertension, diabetes, oral, breast, cervical cancers, COPD, etc. There is a unique national NCD portal. As we talked of e-governance, we talked of e-health. So this is a very unique, another unique thing which is there, which we have started in our country, which is recording all the patient's data and then probably acting as a support for their future health and the continuum of care for NCDs. So we all know that there are non-modifiable risk factors, which include age of the patient, the sex of the patient, the family history, and there are certain modifiable health risk factors which we need to target. Unhealthy diets, lack of physical activity, tobacco use, harmful use of alcohol, and certain environmental factors, including stress and pollution. Now, all of these factors working together give rise to hypertension, impaired blood glucose level, dyslipidemia, obesity, and finally the outcome remains of which we all have come together: cardiovascular diseases, stroke, diabetes, cancers, COPDs, oral problems, etc. So universal health coverage, or the Ayushman Bharat, again is a well concepted approach by our leadership, where the services have been brought together and delivered to a very grassroots level in the form of health and wellness center. So what we are doing at those primary levels is the screening and the prevention of non-communicable diseases. And whenever they feel that there is some issue related to their health, particularly if they find that the waist circumference or the weight or some problem in the blood sugar levels, or if there is some problem in the blood pressure, so they are going to refer the patient to a higher level, along with the health promotion advice, which they ensure that it is given at the basic village level. It moves to the health wellness center, and we have got PHCs, or the primary health centers, which are looking after any patient who is referred from the wellness center. And here there is availability of a doctor which looks after and diagnose the disease. And if it is manageable at the primary health level, he will be managed here, or it will be referred to a community health center or a district hospital, and then we have medical colleges. So this is a whole continued chain, and we ensure that this chain is not broken, and we work in team together to implement Ayushman Bharat. So there are health promoting strategies. Of course, tobacco is a major menace, and to ensure that there is decreased consumption of both tobacco and alcohol, which are the major drivers of non-communicable diseases, we ensure that the there is good monitoring of any tobacco abuse or use, and we implement prevention policies for that. We protect the people from tobacco use, offer help to quit tobacco use. And this is a very important strategy where just a 2-minute counseling to the patient, telling them about the harm of the tobacco, related to the ill effects of tobacco, they really help in quitting the habit of tobacco. And in India, we face a unique tobacco use where there is both the oral and the inhaled form. And it is very addicting. But yes, we have seen that once we try to counsel the patient, repeated counseling, it helps. So, warning about the dangers of the tobacco, enforce bans on tobacco advertising, promotion, and sponsorship, and ways of administration by raising the taxes on the tobacco so that people quit from use of tobacco. Also, this is another problem of excessive consumption of alcohol, which leads to lot many diseases apart from the cardiovascular diseases. So this is a unique initiative which I was talking. We ensure that along with the prevention, along with the stop of use of many harmful products like tobacco and alcohol, we eat healthy things. So we eat things like cereals. We ensure a good amount of fruits and vegetables in the diet. Avoid wherever possible meat, fish, and poultry. Take plenty of water. And all this is being implemented by way of talking, counseling, advocating, and ensuring that people try to have a healthy lifestyle. So for tobacco cessation in 2003, we introduced an act called Cigarette and Tobacco Product Act, which is a COPTA 2003. And by way of this act, we banned in public places the use of tobacco, especially hospitals, public transport, schools, colleges, parks. And we made ensure via this act that there should be a no smoking areas, and in no smoking areas, if someone smoke, it should be taken as an offense. And we all know that younger population are the ones which are the future and which are the priority and which should be prevented from use of these tobacco products. So it should not be sold to anyone under the age of 18 years. It should not be sold anywhere near schools and colleges. There should be ban. There is a ban on advertisements and promotion of tobacco use. And there is a legitimate, a mandatory warning on any tobacco product. So by this way, we are trying to help our citizens for avoiding the use of tobacco. Again, yoga is something which is very dear and near to our country, and our honorable leadership is taking a lead, has taken a lead, and is advocating everyone to follow yoga. And people are gradually adopting this healthy lifestyle. And we all know that there is a Yoga International Day, which is celebrated throughout the world. And by practicing yoga, not only do we remain physically fit, but we ensure and we all know that mental fitness is also developed by practicing yoga. And there is a Fit India movement, which is also a part of our strategy, where we promote anyone and everyone to be involved in physical activities. We facilitate our youngsters to participate in various sports activities, sometimes rewarding and satisfying also for them. So if we see the statistics where we have tried to screen the population for hypertension and diabetes, so almost more than 17 crore peoples they have been screened for hypertension, and a similar number of people have been screened for diabetes. And this data is available on our national NCD portal. So it's again a very unique and a very transparent thing, which tells whosoever will be screened is then put on the NCD portal, and the data is then updated as and when it is required. So a unique initiative from our country was an Indian Hypertension Control Initiative. It was a program which was launched in 2018, and it is now implemented in most of the districts from around 27 states of our country. And we focused that apart from screening, we offer a basic treatment to anyone and everyone of the very remote corners of the country. So simple hypertension treatment protocols where if even a grassroots worker detects hypertension, he or she should be able to manage that hypertension at that particular level in the form of offering some basic medicines like amlodipine, like a simple beta blocker. If that is not manageable, then of course that patient will be referred to a higher center, but at least a basic management is given at a very grassroots level. Under this, it was ensured that the drug supply remains uninterrupted. There is monitoring to assess the treatment coverage and the blood pressure control. A longitudinal patient follow-up is very necessary for any chronic disease. And this we ensure through our app, which I will be discussing in the upcoming slides. It's an application-based project in which we enter the health records of the patient, and anytime that record is accessible to the healthcare worker, if the patient comes today or 6 months later, that record will be updated. So ST elevation myocardial infarction, again, we all know that our country is very huge, and the healthcare, the immediate urgent healthcare, it may not reach timely at the remotest area. To ensure that there is a timely availability of the necessary health and the infrastructure, particularly for urgent medical conditions like ST elevated myocardial infarction. So we introduced a hub and spoke model. Now, this is also a very basic and a very good model. So what is this hub and spoke model? So if you just see at this diagram, so hub is one where every facility is available. It may be somewhere a tertiary care hospital or a district hospital. And these are the basically spikes from where the patient has to come to the hub. And anyone who is here, it is ensured that the patient just reach the spoke where there is a facility to transport the patient to the hub. So as I mentioned, that time management is very important. And by this hub and spoke model, we try to ensure that the patient reaches the appropriate place in a timely manner. So awareness about the signs and symptoms of ST elevation MI. Now, this is being advocated, this is being told to the grassroots workers so that they are the ones who will be able to help the patients who reach them. And probably from here, the patients will then come to the hub. A basic ECG facility is also available at community health center and primary health centers. And if they need a thrombolysis, so it will be done at the main hub as soon as they reach. So these are the guidelines which are timely updated and released by the Ministry of Health and Family Welfare. under the guidance of Directorate General of Health Services. Now, stroke is another problem where we took the help of this hub and spoke model. Now, again, hub will be something which will be in the district hospital, in the medical college, or the tertiary care hospital. And like for the myocardial infarction, spokes will be like at a district hospital or CHC, and the patient has to be brought to the hub in a timely manner where the facilities like CT scan is available. And in case of ischemic strokes, thrombolysis, or the necessary management will be done by the expert. So simultaneously, prevention and treatment is being given. And again, this is another effort by the country, which is by the name of 75 into 25 initiative. This ensures that 75 million people with hypertension and diabetes are on standard care by the year 2025. An accelerated and focused approach to achieve target under the National Health Policy 2017. 80% of known hypertensive and diabetic patients to be under the control by 2025. And it is a roadmap to scale up hypertension and diabetes services in primary healthcare. So this is also an initiative where we enhance the services to the suspected patients, at least for screening and treatment of hypertension and diabetes. Cancers are again no far behind in non-communicable diseases, and prevention is always better than cure. The early prevention, the early detection, the early screening, it will help in reducing the mortality associated with cancers. And for this, the population-based screening program, it was launched as a package under comprehensive primary healthcare in 2018, where population more than 30 years of age was screened for all common NCDs, including cancers, prevention, control, and screening services through our frontline workers, the grassroots workers, which are ASHA workers and ANMs, along with the referral support system, so that the screening and treatment is possible. And it is being implemented in health and wellness centers as a part of comprehensive primary healthcare under Ayushman Bharat program. And population-based screening helps in better management of diseases, again by the way of early detection, follow-up, and treatment of adherence. And it generates awareness on the risk factors of NCDs. So if you just look at the burden of common cancers in India, it is estimated that the new cancers, this will rise from nearly 1 million new cases in 2012 to over 1.5 million by 2035. And breast cancer, it has emerged as one of the leading causes of cancers in women, with more than 150,000 cases, every new cases. Cervical cancer is equally prevalent in women, and oral cancers, they account for 7.2% of all the cancers. So it is always desired that early screening of these NCDs should be given a priority. And this is the way by which we are doing the basic screening and early detection of carcinomas. A patient with a lump in the breast, which is detected by breast self-examination or the clinical breast examination at subcenter or PSC. First, the patient will feel the lump. It will be confirmed by the trained person at sub-center or PSC level. And if the trained person feels that it is not significant, so it may be screened as per the protocol. If the lump is positive, significant, then it will be referred to a higher center where facilities like ultrasound, mammography, they will tell whether it is a significant lump or not. And if it is some suspicious or malignancy, the patient will be immediately referred to a medical college or regional cancer center. So this chain is very important, starting from the health education of the patient themselves, then the grassroots workers, then the intermediate healthcare workers who are working at the community health centers, a timely referral, detection, and the treatment. So this is how we manage and try to look for the cancers. Now, again, tobacco we have discussed, a major thing responsible for cancers. This is something which is very addicting and difficult in our part of the world, where both smoking and oral tobacco commonly responsible for oral cancers, alcohol, aging population, ill-filled dentures, so all contributing to the oral cancers. So what are we doing? So we are strengthening our tertiary care centers. Under this, state cancer institutes and the tertiary cancer care centers are being developed. And at the moment, 39 institutions, both state and center funded, are there in our country. They are getting the maximum support grant from the government of India. And the activities which they carry at their center are, of course, the diagnosis and the treatment, coordination of the cancer-related activities in their respective geographical areas, training and research, which is of most importance, outreach and screening activities, palliative care wherever possible. So another problem, chronic kidney disease, which is a part of NCDs and both cardiovascular diseases in the form of maybe a cardiorenal syndrome or kidney disease leading to inflammation and promoting atherosclerosis, or the otherwise where cardiovascular diseases like hypertension causing chronic kidney disease. So under the Pradhan Mantri National Dialysis Program, it was started somewhere in 2016-17, where any patient requiring dialysis is being given dialysis at various established centers, even at the level of district hospitals. And this program is now being promoted, facilitated, and funded by the government of India. And most of the states in our country are now implementing this program and helping the patients of chronic kidney disease by way of dialysis. This is a huge problem now. Non-alcoholic fatty liver disease, diet, obesity, metabolic disorders, all leading to non-alcoholic fatty liver disease. And happily, this program has also been included in our national program for control of non-communicable diseases, where the population-based screening is being done for the risk factors for NCDs, higher and patients who are at high risk, they are referred to primary health centers, again at the CHCs, and if they need treatment, to the district hospitals. And we all know that for such diseases, prevention, healthy lifestyle, adopting yoga, exercises. So these are certain things which will prevent this upcoming epidemic. So this is a unique portal by our implemented under the leadership of our country, where we ensure that the health data of any individual is being recorded in our national NCD portal. So the system enables population enumeration, risk assessment, and screening of the entire population. And it collects information on the risk factors for NCDs for 30 plus population. And we believe that a holistic approach is needed in our healthcare system. So it is not only the focus on the health, but it is the wellness which is equally important. So the first initiative was done in 2018 when this portal was launched. And under this portal, every grassroots worker is using a mobile app. In this mobile app, the population which is covered by that particular worker, it will be entered, and that population will be screened for 5 common NCDs. And wherever there is a need for support from a higher center, so these will be referred to a medical officer, which will be in the primary health center. And these patients are then given advice, given treatment, made a proper diagnosis, and wherever needed, they are being referred to the higher centers, as you can see. And like from ASHA worker to the ANM, to the medical officer, to the specialist. And whole of this program is being monitored via the form of an app, which is accessible to the monitors, which are there in the ministry, the administrative officers. And that's how this program is being run on a very fair basis. So till now, even more than 50 crore population has been digitally enrolled under this program throughout the country, and more people are being screened for any NCD. So this was a program where what I was talking, where it is not only an individual health ministry which works for prevention of NCDs, it is a multi-sectoral action plan where most of the ministries are incorporated, are collaborated for the action of our national plan for control of communicable diseases. They may include Ministry from Education, Ministry for Information Broadcasting, Niti Aayog, Agriculture, Women Development, Sports Ministry, Ayush Ministry. So it's a collaborative effort from all the sectors. So while significant strides have been made, there remains notable areas for improvement in addressing cardiovascular diseases. There's a pressing need to give more focus on reinforcing preventive measures and health promotion activities to tackle the underlying cause of CVDs effectively. Furthermore, prioritizing capacity building initiative among healthcare workers, particularly in primary and secondary healthcare settings, is essential to elevate the standard care delivered to the patients with cardiovascular diseases, ultimately contributing to better health outcomes across the population. So, in conclusion, it is evident that addressing cardiovascular diseases demands collaborative efforts and collective action, aligning perfectly with the objectives of the SCO International Medical Forum. And we believe that by engaging in such platforms, India stands to benefit from the exchange of best practices, innovative strategies, and cutting edge technologies in the field of cardiology and cardiac surgery. So active participation in these endeavors not only enhance our capacity to tackle CVDs, but it also fosters international cooperation, paving the way for improved cardiovascular health outcomes and a healthier future. So with this, I would like to thank the organizers, the SCO countries, for inviting us in this conference. Thank you very much.
Thank you, dear Professor, for your interesting talk and sharing your experience. I think in our country we have same tendency about non-communicable disorders, and here we have participators about more than 200 participators offline and also more than 20 online. And we have some questions to you. It's possible to ask some questions?
Yes, sure.
First question, it's about who is providing primary screening in rural areas and as well in big cities. It's provided by a general physician or something else?
Right. So that's actually a very good question and probably the theme of the presentation which I have done. So see, in India, we have divided the country into different levels of strata. The one is the tertiary level, which is of course available in the main big cities, but that will not cater to the population. So we have district hospitals, like the whole state is divided into districts. So there are many districts in a particular state. Those states constitute the country. So country has states, states have districts, districts have community health centers. Community health centers have primary health centers. Primary health centers have some, again, a very small subset, villages, where there is an Anganwadi worker or an ASHA worker. So that is not a doctor or a trained nurse. Those are from their communities. So they will ensure they are basically in touch with the population, with the ground population who are staying in that particular village. So they are very friendly to that particular village. So a village constitutes a population of say 1,000 people. So that ASHA worker will screen, will look after that particular population, maybe vaccination, maybe screening of those people. And then she will record that thing in her app, in that mobile app, that data. And if she finds something which is alarming, so she will refer the patient to the, again, the community health center or the primary health center. So in this way, this chain is there so that every patient is screened at the very grassroots level. And wherever the treatment is required, that particular patient is not missed or ignored. That the data of the patient is recorded, and it is ensured that that patient reaches to a higher level for that particular treatment. So this is the way we work in our country.
Thank you. That means coverage of population, it's about 100%.
We try to see it cannot be 100%, otherwise it would have been something which is always desired. But of course, we are trying to get it over 100%.
Thank you. Another question to you. Do you have any collaboration with national TVs to increase awareness of about risk factors of non-communicable disorders?
Can you get it again? Collaboration with
national TVs. TV.
National TV?
Yeah.
Television, you say?
Do you have any connections or collaboration with national TV to increase awareness of population about non-communicable disorders risk factors?
See, there is a whole Ministry of Health and Family Welfare, which looks after every health program. So as I started in the beginning, so our goal is mainly emphasized on prevention. So as we all know, these diseases are all preventable, and the earlier we initiate, the better it will be. So we frame the guidelines. We ensure that those guidelines, those health promotion activities reach the basic grassroots level along with the tertiary care level, where these guidelines are updated and upgraded. And of course, the media and the other things are also very much a part of our health promoting activities, so that these are timely. These activities timely reach the necessary population.
Okay, thank you, thank you. Questions are over. Thank you very much, Professor, for connection. And
Thank you
another
very much.
question, wait a bit. One more question.
I have
Yes, please.
one question. Can you tell us which methods, which ways of working with a population is most effective in prevention of cardiovascular disease or other non-communicable disease?
So if I have to repeat your question, that you're asking me that which are the various ways and most effective ways of preventing cardiovascular diseases amongst the non-communicable diseases. Is it that? Yeah. So you see, again, prevention is always better than cure. We all know, and nothing more than to emphasize on this. So the risk factors, particularly if you talk of our population, so genetic factors we cannot ignore. They are non-modifiable. Age is non-modifiable. But something like tobacco, which is a menace in our part of the country, alcohol, high fatty diet, lack of physical activity. So these are 5 core components, I think, if we all address throughout the globe, so they are certainly going to reduce non-communicable disease, particularly cardiovascular disease, maybe hypertension, maybe obesity, maybe oral cancers. All are related to our eating habits, ultimately our say habits of addictions like tobacco, alcohol, some IV, and those things, and of course physical activity. And I'm glad to share that yoga is one thing which has been practiced and been advocated, and the stress which is being relieved by promoting physical activity and yoga and medication, they are certainly going to help in preventing cardiovascular disease, especially post COVID, when we are seeing a lot of mortality which are being done in happening in this young population. So am I able to satisfactorily address your question, sir?
I was asking, is it, for example, working with mass media more effective or some, for example, face-to-face physician work with the population is more effective?
Yes. So again, see, there is no doubt that face-to-face interaction with anyone is going to impact that fellow very much. Like had I been physically present at your place, so probably I would have made a better presentation and better impact on. But having said that, repeated reinforcement of advice, whether related to tobacco cessation, whether related to dietary habits, whether related to physical activity, does make a good impact on the patient. On any day, face-to-face interaction is very nice. But yes, if you give the patient to read something, if you say an online interaction, maybe on mobile or something like a message, so they are equally going to impact as far as the NCDs are concerned. Yeah.
Okay, thank you. Thank you for clear explanation. And nice to meet you. Have a good day,
Yes.
Professor.
Thank you. Thank you, madam. Thank you.